I'm Paul Hochfeld. I'm a recently retired emergency physician, and I spent all 35 years at Samaritan Regional Medical Center in the emergency room. And my goal today is to get you to rethink what this is about. And instead of thinking about the single payer, think about the risk pools. Think about a single risk pool. And I'm not coming as a bleeding heart liberal with some socialist agenda. I'm coming as a taxpayer who's really tired of getting ripped off, and as a physician who bristles at the idea that we even have a healthcare system. Because the only thing systematic about it is it's made up of a bunch of economic entities that are trying to profit largely with public money, because 35% or 60% of all of our healthcare dollars, either directly or indirectly, comes from the taxpayer. And we spend, as you know, twice as much as most other developed countries. But what we're really good at this country, better than anybody else, aside from paying a lot for drugs, is we're good at separating our people into risk pools. Nobody does it as good as we do. So let's look at the risk pools. There's old people, and they're covered by Medicare, and old people have high health care costs because a lot of them are going to die soon. And who pays for that? Taxpayer. And then there's disabled people, and they're covered through Medicare, and they're expensive. And who pays for that? The taxpayer. Then there's poor people who get covered by Medicaid. And if you ask Chung Wei Chi or any healthcare authority, they'll tell you that health follows wealth and sickness follows poverty. So poor people are high risk, they're expensive, and the taxpayer pays for them. And the taxpayer pays for Native Americans who have their own set of problems, and the taxpayer pays for vets, and the taxpayer pays for the military. These are all really expensive people because they've got serious problems, and we really have to pay for them. So what about the rest? They're covered by private health insurance, and they're mostly employed people and their families. And employed people and their families are inherently in a low risk because they're employed and they've got some resources. And their care is subsidized by the taxpayer because employers deduct the cost of health care, and now low-income employees get money through the Affordable Care Act if their income isn't too high. And then we've got the people that fall through the cracks, the people who don't have insurance. And among those are immigrants, legal and otherwise. And when they can't get the care that they need when they need it, and they end up in my emergency room with a bad problem that could have been cared for a lot cheaper earlier, and they end up in the ICU, and they can't pay their bill, then what happens? Well, the hospital loses money on the bill, and we all see higher charges from the hospitals because of bad debt. So we're all paying for them anyway. So the question is, what do we get for slicing and dicing our population into all these different risk pools? Well, we really get a bunch of insurance companies that are profiting from it, insurance companies that are trying to manipulate federal legislation so that they can make more money. And I'm referring to the Affordable Care Act, which does some really good things, undeniably, but has increased administrative costs, undeniably. And basically, what we get for slicing and dicing is it increases total health care costs by about 20%. That's 20% of all of our health care dollars that could be going to health care, but instead is going into excessive administrative costs because providers have to pay more to collect from these hundreds of insurance companies, all with different sets of rules. And the insurance companies themselves are competing for low-risk populations by, for instance, renaming stadiums. Just saying. So at its core, SB631 is about ending this sort of ludicrous, counterproductive activity of separating us into all these different risk pools, harnessing the taxpayer with paying for all the high-risk pools, and then telling the taxpayer they have to subsidize the rest of the people so the insurance companies can make money. It's just crazy. So I know there's a lot of fear of more government involvement in healthcare financing, but I think we need to sort of get over it and admit that we're all paying for everybody anyway. We're all paying for everybody anyway. I keep coming back to that. We need to design a system that reflects that reality and put everybody in the same risk pool. And that's what HB 631 does at its core. And 631 is not ready to be passed, I understand, but I would really urge the committee members to work very hard to craft a single risk pool legislation that you can embrace.